Hello, my name is Nurse Pauline RN. Welcome to my channel. Welcome to all my subscribers. Welcome to all my new visitors. Today, the title of my video is Fundamentals of Nursing, Exam 6. I would like to introduce you to my 49 chapters of Fundamentals of Nursing, starting consecutively from chapter 1, 2, 3, 4, 5, all the way to chapter 49. These chapters are very good chapters. They answer all your fundamentals of exam NCLEX questions. Okay, we will begin today by asking you to hit the like button as requested by YouTube's. I need more likes on this channel, please. I would like you to subscribe if you have not subscribed as yet. I would like you to share this channel with your friends, families, nursing students. Okay, let's begin. We're continuing with sexually transmitted diseases. Likely causes of STI and HIV among ethnic groups are values, expectations about sexual behavior among men and women in the culture, religious beliefs, cultural attitudes towards the use of contraceptives, educational background and knowledge of health risks associated with sexual behaviors. We're teaching birth control to our patients. There is a long-lasting hormonal injection given every 12 weeks. Sexual function can affect negatively by some medications, causing erectile dysfunction in men. If your patient is a Muslim, this patient may be on dietary restriction because this patient will refuse pork. If you have your exam questions and you see egg and bacon in the tray, you have to replace that tray. No bacon, please. Always sit down and talk to your patients. Have patients discuss feelings. Listen attentively is appropriate intervention for support and well-being of your patients. Patient state he or she does not believe in a higher power. Most likely your patient is an agnostic. Palliative care is appropriate for people with any diagnosis with serious illness. Palliative care are not only for dying patient. Palliative care provides pain relief for serious illnesses. Palliative care team member primary obligation for the patient is severe pain management, is to enhance quality of life. When providing post-mortem care, priority action for the nurse is providing culturally, religiously sensitive care in body preparation. We're talking about advantageous crises. We are in crisis. Tsunamis, natural disasters, floods, fires, earthquakes. When assessing older patients showing symptoms of anxiety, depression, insomnia, anorexia, confusion, first assessment includes a thorough physical assessment and examination. Job-related stress can affect the quality of patient care. Stress can affect a nurse's efficiency and decision-making. Nurses frequently experience stress with rapid changing in healthcare technology. Strategies that are effective in helping patients and families to cope with illnesses are referral to social services, coordinating hospital-based and home-based schooling with teachers, teaching signs and symptoms of diseases. We're talking about activity exercise. We're talking about the proper use of a cane. Keep patient using 2 points of support on floor at all times. We're teaching body alignment of the patient in a tripod position, includes an erect back and neck, straight vertebrae, extended hips and knees. Definition of your tripod position for patient is respiratory distress. Patient may be out of breath. Patient sits or stands leaning forward and supports the upper body with hands on knees or on other surface. Patient experiencing problems with joint stability. Doctor prescribes crutches for this patient to use while still bearing Doctor prescribes crutches to use while still being allowed to bear weight on both legs. This patient will teach 4-point GAIT, bearing weight on both legs. Providing information to patient when he or she is ready to change behavior. This motivates patient to participate in an exercise program. Principles of proper body mechanics when lifting or carrying objects. Maintain a wide base of support. Encourage patients to help as much as needed. Older adults with progressive loss of total bone mass and tendency to take smaller steps with feet kept closer together. This increases the patient's risk for falls and injuries. Childhood obesity as a result of children being less physically active outside of school. Nurse unable to transfer patient bed to chair and chair to bed, call the lift team for help. Ascending stairs on crutches. The unaffected leg is advanced between the crutches to the stair. This is called the modified 3-point GAIT. Before transferring a patient to bed, Before transferring a patient from bed to stretcher, first assessment. Assess your patient's weight, level of cooperation, patient's ability to assist, presence of medical equipment, example oxygen tubes, Foley catheter tubes, IV lines, before transferring patients from bed to stretcher. Reinforce crutch walking for your patients. No weight bearing on one leg. Most appropriate crutch GAIT is 3-point GAIT. Patients returning from recovery room, PACU, after procedure or surgery requiring conscious sedation, indicates additional assistance to transfer patients out of bed. All your post-op patients first day out of bed have standby assistance, please. Nurse encourages patients with type 2 diabetes to engage in an exercise program, primarily to improve the patient's overall cardiac output, thereby resuming resting heart rate. To reduce the risk of musculoskeletal disorders that are prevalent and debilitating occupational health hazard for nurses. To reduce this risk, use assistive equipment and devices to decrease debilitating occupational health hazards in nurses. We're talking about hygiene to prevent aspiration during oral care for your unresponsive patient. Proper position, which is important in NCLEX, Sims position, semi-Fowler position with head turned to the side to prevent aspiration. Teaching foot care to diabetic patient, safety precaution. Assess skin for redness, abrasion, and open areas daily. Apply lotion to feet daily. Clean between toes daily. Dry between toes thoroughly to prevent moisture. Do not put lotions between toes. To promote venous circulation, nurse uses long, firm strokes, distal to proximal, while bathing legs to promote venous circulation. Integrity of oral mucosa depends on salivary secretions. Factors that impair salivary secretions are radiation therapy and dehydration. Patients most at risk for developing skin problems and requiring thorough bathing and skin cares are the elderly with diabetes, with dementia, incontinent patients of urine and stool, patients with reduced loss of consciousness and require mouth care before the procedure. Assess respirations, assess gag reflex. Instructions for patient using contact lenses. Follow recommendations of contact lenses manufacturer when inserting lenses. When inserting lens, keep lens moist or wet when not worn. Use fresh solution daily when storing. Patients at risk for poor hygiene, use antimicrobial toothpaste. Use 0.12% chlorhexidine gluconate, CHG oral rinses. Use soft toothbrush for oral care. Highest priority when planning bathing for your patient who gets bath first in the morning. First for bath cares are your patients who are experiencing frequent incontinence, diarrhea, urine stools. Factors that are normal aging changes that can affect older adults, oral health. Dentures do not fit properly. You can use Fixodent, one of those. Many older adults are lacking of teeth, and remaining teeth are often decayed. For stroke patients during a bath, provide ROM, range of motion exercises to extremities. Patient a Middle Eastern bathing with left arm. This behavior is likely a cultural norm. Patient with thrombocytopenia, use electric razor for shaving, risk for bleeding. Patient receiving chemotherapy experiences stomatitis, teach use of normal saline rinses. We're talking about oxygenation now, risk for smoking, cardiopulmonary diseases, lung cancer. Patient diagnosed with iron deficiency and anemia. Symptoms associated with decreased oxygenation are decreased activity tolerance, increased breathlessness. We're talking about carbon monoxide poisoning. Patient is at risk for decreased oxygen carrying capacity of blood because carbon monoxide forms a strong bond with hemoglobin, thus preventing oxygen binding to the lungs. Patients with chills, fever are at risk for dyspnea. Fever elevates the metabolic demand, requiring more oxygen need. Patient with severe left-sided heart failure, advantageous lung sounds on auscultation, expect inspiratory crackles on lung bases. Patients with decreased mobility, this intervention, simple, cost-effective method for reducing the risk of pulmonary complication is frequent position changes. Patients with pneumonia, indication for airway suctioning, which decreases ability to clear airway through coughing. Patient with pneumonia, indication for airway suctioning is decreased ability to clear airway through coughing. Patient in MVA, motor vehicle accident, with fractured ribs secondary to pneumothorax, assessment, sharp pleuritic pain that worsens on inspiration, worsening dyspnea, absent lung sounds to auscultation on affected side. Patient with lung cancer, teach rest between activities, not to get short of breath. Practice pursed lips breathing technique to improve exercise tolerance. Use 2 to 3 pillows to prop up if have trouble breathing. Assess patients with shortness of breath, elevated heart rate, lying in supine position. Priority for this patient is to raise the head of bed 45 degrees higher for patients with shortness of breath, elevated heart rate, lying in a supine position. Patient with labored breathing using accessory muscles and is coughing, pink 40 sputum, has diminished breath sounds in bilateral lungs, bases. Priority assessment before notifying the doctor. Check the patient's SpO2, check the patient's oxygen, check the patient's pulse ox, should be greater than 92%. Check the amount, color, consistency of sputum production. Assess change in respiratory rate and pattern. Then, when you have all these assessments written down, then you can call your doctor. Then you can notify your doctor. Sequence for suctioning patients. Please check your clinical procedure book. This is in all exams. Most important, when you're suctioning your patients, please turn the oxygen up to 100% high before you suction your patient. When you're finished, return the oxygen level to the previous level. Stand by the bedside, stay with the patient, assess your patients, check the patient's pulse ox. When the patient is back to a rested, relaxed state, make sure the oxygen is greater than 92. Patient is fine. Then you can leave the bedside. Nurse can delegate to a PCT or tech oropharyngeal suctioning of a stable patient. Oral suctioning at the bedside. Yanker suctioning is a handheld suction at the bedside. PCT techs, they take care of stable patients. RN takes care of unstable patients. Thank you. Don't forget to hit your like button, please. Please subscribe if you have not subscribed. Please share with nursing students this video. Please share this video with your friends. Please share this video with your families. Please have a good day. Stay blessed. Thank you. And I'll see you in my next exam, which will be very soon. Examination number 7. We are getting there. I'm trying to do 10 videos of examination. Thank you. Have a blessed day.